Again, that number is 800-859-0957. You won't want to miss this opportunity to talk to the doctors directly. You're listening to the Dr. Thompson radio show on 760 WJR. So now we're going to Facebook, but we have to keep our eye on. Are you able to see the clock from where you are? Yeah.
Okay. Yeah.
So did you have to add more,
Yeah,
Dr. Thompson?
just a really quick comment, and maybe Chelsea could do it at the end. But I wanted Marla to know that if she's having any trouble with her dentures, if she added a couple implants, it would really stabilize her dentures and make her teeth function so much better. So I wanted maybe Chelsea to throw that part in.
Mm-hmm. Yeah, when we come back, you can add that on.
Yeah, you can say it on the air.
Okay. Say it right now. We're on Facebook Live.
And to Marla, I want to address Marla specifically.
Right, exactly. Our last caller, exactly. Mm-hmm. So, I mean, but what we want to come back and talk about certainly is the fact that not all dentists are doing what you're doing. It's not like a lot of us go to see our dentist every year for a checkup, but that includes getting an x-ray and having a hygienist come in and clean your teeth. Mm-hmm. And then if nothing's wrong, we'll see you next year. But nobody's doing what you're doing. I mean, there's a handful of doctors maybe that are doing what you're doing. So I think the thrust of your practice has got to be that you're actually deeply involved in prevention of serious diseases. And that's something that's something that people really need to know. They just don't realize. I mean, people don't even know that they have oral pathogens. They just don't know what's crawling around inside their mouth. Mm-hmm. And I think that, knowing that this type of practice is very unusual as far as dental practices go, and that they need to invest in, whether it's your practice or someone else's, but you need to, when you're going to see a dentist, that should be a part of the bigger picture. And I think that's why we want to talk about the Wellness Dentistry Network. I think you need to talk about that because you're actually doing training with dentists all over the country.
Yeah, and that's just the push that Chelsea and I are making with other practitioners and professionals. We want to train them to be aware of that and to know what to do with that, because I can tell you, in Michigan, we have a lot of people that go to Florida and other places, and I want to make sure they have somebody who can competently take care of them. Because wherever they are in the world, Anne-Marie, people with dental disease need to be seen more than just one time a year or twice a year. Some of these people need to be seen multiple times per year, and we need professionals all across the globe that know how to take care of these people and know how to evaluate them.
That's a really important thing. I was going to say, well, I can say it on the air. Sorry, Mark. We got 15 seconds.
Do you have the printout for this? You need the printout. Welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Thompson and his partner, Dr. Watkins, general dentists and oral health specialists in Bloomfield Hills, Michigan. They're with us tonight discussing the latest diagnostic methods that they use to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctors, please call us at 800-859-0957. Coming back, Dr. Thompson, you wanted to finish up with Marla, your last caller?
Yeah, I just wanted to let Marla know that if anybody has dentures, and this pertains to Marla, that aren't working so well, with the addition of a couple implants in either the upper arch or the lower arch, we can make that denture work so much better. So I just want people to know that if they have dentures and they have issues eating, and maybe they remember how it was to eat before they had dentures, if you ever want to restore some of that confidence back again, we can help them do that.
All right, and Siobhan, you had a comment you wanted to make when we were on Facebook?
over the Facebook, the Facebook Live break, we were talking about this network of dentists across the country, and I was going to say, from my experience as someone that travels, one of the hardest things is knowing where in a different city I can find somebody that might have the same knowledge base or access to the types of treatments that you talk about. And, for me, I often have to travel home and wait months, and sometimes things have developed by that point. So that's a huge asset, I think.
Yeah, and so what I would say is to even people like, the Marlas of the world, she maybe needs a one-time-a-year oral abnormality exam. But for other people that have teeth that could have periodontal disease or other issues, they need more frequent examinations. So what Chelsea and I would tell people is wherever you are in the world, you really should have some professional health care either 4 times a year or 3 times a year. It's very important. Most people today probably need a little bit more than twice a year. And I don't know if Chelsea, if you want to comment about that, but periodontal disease is so significant that we need people to get care. So we developed a thing called the Wellness Dentistry Network. And maybe Chelsea could talk a little bit about the network because she kind of runs it.
Yeah, so the Wellness Dentistry Network, to your point earlier, is a nice tool to utilize for practitioners, but also for patients as well. As a patient, you can go to the homepage, and it's just wellnessdentistrynetwork.com, and you can search for dentists in your area who participate in the network and have access to all of the wellness materials that Dr. Thompson has developed over the years, access to lectures that he's put on and provided that help them implement the same or similar methods of practice into their personal practice. So it's a great thing to use if you're traveling or moving. If we have patients who are relocating, we'll go on and give them names of practices and dentists in their new area that they can reach out to once they're moved.
So the difference between your average dental practice and what you are doing with the Wellness Dentistry Network and with your type of practice is that you're very deeply involved in diagnosing and looking for pathogens in the mouth that lead to serious diseases. So you're kind of doctor dentist. You're kind of a mixture of, the physician and the dentist, which is wonderful for people because most people don't even know that they have oral pathogens or what the danger is for the oral pathogens or the fact that there's stuff crawling around in your mouth that if it gets underneath your gums, it can lead to really serious. And the thing is chronic debilitating disease. It's not a little disease. It could be a big lifelong disease. So it's very, very important, I think, that most people out there just think about dentists as being, I'm going to get my x-rays, I'm going to see my dental hygienist, and then I've no cavities, I'm home free, and that's it. So the most important message I think we have here is to let the listeners know that you need to engage with a dental practice that's practicing this type of health screening. Very important.
Yeah, and us as dentists, we have a great advantage and opportunity because we get to spend more one-on-one time with patients than the average physician would get to during an annual exam, and we get to see patients more often. Some patients go years without going to their physician, which some patients go years without going to their dentist as well, but most of our patients we're seeing 2 to 4 times a year, which is much more than they're seeing their doctors. So
No, that's a very good point because now with population medicine, and I certainly do other radio shows based on this topic, and now everybody's lucky, if they can get in to see a physician. If you get referred to a specialist, you're looking at waiting a month to 3 months to get in. And if you do go to see your PCP, maybe you got 5 minutes tops, and it's usually what's wrong with you today that I'm going to fix. It's not, let's look at some of the underlying stuff that's simmering in your body or in your bloodstream. And I think that to your point, when you were talking about, you go to see your doctor, you're lucky you get 5 minutes, but if you're sitting in the dental chair, you're probably going to be there for a while. And so and I didn't think about this until you brought it up, that you're in the dental chair being examined, and here's your time for conversation. I do want to ask you, though, what is the method that you use? Because a lot of people don't understand. They don't know there are pathogens in their mouth, but what do you do to find them? Walk us through that experience for a new patient.
Dr. Thompson, do you want to talk about this, or would you like me to?
Well, one of the things that we do is we have to do a very thorough gum and bone exam because most of the pathogens are lying in the gum tissue or on the teeth or on the oral tissues that support the teeth. And so we want to do a very thorough oral gum and bone exam. And Anne-Marie, we basically have been at a point where we only do pathogen testing on people that have disease. They already have existing disease. We see that through our examination process, and then we would recommend a saliva test. I'm starting to do this on most new patients because you would not believe the amount of bacteria that we find in people that are not, they're totally not expressing the oral disease. And so what that means is if you have high levels of bacteria, yeast, or viruses that live in your mouth, that are detrimental to your systemic health, we'd want to know about it even if they weren't affecting your dental health as much. So now we're getting to be even more savvy and more sophisticated. And that examination process not only involves a gum and bone examination, but it involves 5 other key areas of oral health, but then it involves 15 other areas of overall health. We want to talk to patients about nutrition. We want to talk to patients about stress management, about lifestyle issues, about sleep medicine, which is very, very important. We want to talk to patients about pollutants that are in their body, mercury contamination from metallic and alloys that have been used in the mouth. So when you think about all these areas, 15 different areas in addition to the 6 areas of the mouth, with gum and bone exam being probably the most important, we want to really evaluate the patients and then give them the information they need so they can make healthcare decisions that will render them healthier. For what? Why are we trying to do it? Increase longevity and vitality. Look, no one wants to live longer if they're not healthy. But if you want to live longer and you want to be healthy, we can help you do that.
Well, you want to be healthy for as long as you live. But another fallacy, while we have some time just to mention this, is that I think a lot of people think that, oh, if I use mouthwash once or twice a day, I'm good. I'm okay. If I have pathogens in my mouth, it kills them. And this is really important. It does not. Right?
Yeah, not only does it not, but depending on what mouth rinse you're using, you could be using one that's contributing to the problem. A lot of commercial mouth rinses are acidic, which can actually contribute or exacerbate an imbalanced bacterial composition in the mouth and make the problem worse.
Oh, well, these are things that people don't know. I think that they're just not aware of the, diagnostic possibilities of getting into a practice like your practice. And it's great, Dr. Thompson, that you're both teaching other dentists so that we have the opportunity, if somebody's going to Florida or they have relatives living in other states, that they can find out who belongs to the Wellness Dentistry Network and get hooked up with a doctor. We want to come back at the other side of the break and talk a little bit more about what you're doing with sleep apnea as well, because you're also involved in bringing that to the awareness of a lot of your patients.
If you can't breathe, you can't live.
No, that's for sure. In the meantime, we're going to have to take a quick break. You are listening to the Dr. Doug Thompson radio show, and we are talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can call the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR. And we are back on Facebook.
Yeah, that was wild. I didn't know about the mouthwash that could be making it worse. That's so counterintuitive.
Yeah, I thought about that, right?
That's really surprising.
Mm-hmm.
Maybe Chelsea can explain a little bit more about what that's all about.
Well, if you're using a mouth rinse that's acidic, you're going to promote the growth of the bad bacteria that help cause disease, not only gum disease, but also cavities as well. With cavities, there's a huge acidic component. Acid really drives the disease, so it can make cavities progress faster. And then also you can have, if you have signs of acid wear on the teeth, you can make those areas worse, which can cause sensitivity, and just decrease in tooth structure and strength over time. So knowing that about some of the common commercial mouth rinses is really important for a lot of reasons.
Wow.
So what we do in the practice, we have a sheet that starts to guide practitioners, because you know what happens. You go to Walgreens or
Right.
any Rite Aid, and you walk into the mouth rinse aisle, and it's like going into the yogurt aisle at the supermarket. I mean, it's like, which one do I pick? And you got to
It's overwhelming.
You got to read all the labels. How much sugar's in here? Is it healthy? What kind of bacteria in here? And it's overwhelming, and you don't know. So we give patients a very nice information about which rinses are healthy for you and which rinses aren't healthy for you. But I would just add one more thing about the mouth rinse conversation. If you don't have oral disease, you don't need mouth rinse. Maybe you might want to have a breath mint to make your breath better, or maybe you want to be more social and you want to chew a piece of gum or something like that, maybe with sugarless gum. But you don't need mouth rinse if your mouth has a healthy balance. So, but to Chelsea's point, we have a lot of people that don't have healthy dentition, and they need to have some kind of rinse to help keep the bad bacteria at bay. But if they're using the wrong one, then it's worse. That's the idea.
Who would know that? I mean, most people have no clue, you know? I mean, I think that they think that, okay, if there are, if there's some bacteria in my mouth, I get up and I swish my mouth out in the morning, gargle, spit it out, I'm okay. I bet you everyone thinks that. Most people would think it. And then adding on to this, the fact that, not all mouthwashes are created equal, and some of them are actually counterproductive to, what you're using them for. I mean, the average consumer doesn't know.
Right.
I mean, they don't even know about finding a doctor, finding a dentist. It's unfortunate that, getting in the right hands is nigh impossible. And I do want to come back and talk about the sleep apnea. Can we do that when we come back?
Our mission, yeah, we can. And our mission is to change that. Our mission is to create more people who have more knowledge, who can help people in these ways. And we're only scratching the surface as to really what we do in the assessment in the office. So it's a very robust assessment, and it's an amazing opportunity for people to learn a lot about their oral health, but not only that, but to figure out other issues in their systemic health that could be affected by their oral health.
Yeah, it's really important. But I mean, what you're doing is giving great information out there. We're actually teaching people that are listening in and tuning in. So we will be back on live in a couple of seconds. Welcome back to this special edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are talking with Dr. Thompson and his partner, Dr. Watkins, dentists, and he is a pioneer in prevention from Bloomfield Hills, Michigan. They're here tonight explaining the medical diagnostic model they incorporate in their clinic to screen many of the catastrophic diseases from cardiac disease to Alzheimer's that through early detection can be prevented. If you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957. Dr. Thompson, over the break, you said something that struck a chord about your mission. For the listeners, can you explain to them what is your mission?
Well, my mission is to create not only my local practice that really helps people not only understand their oral health, but what that really helps them understand how their oral conditions, different conditions in the mouth, how it can affect their overall systemic health. We have people, Anne-Marie, that are in their 30s that have a bad oral, what we call microbiome. It's the bugs that live in their mouth. And if you have that in your 30s, what the current research and what the current science is showing is that those bugs contribute a lot to dementia, Alzheimer's, heart disease, diabetes, 57 other diseases.
Right.
So what does that mean? That means if we could identify those bacteria, yeast, or viruses for those people, and we could create a plan for how to help them suppress that population or even exterminate that population, the unhealthy bugs, just think of what we could save them over their lifetime. We could prevent the onset of Alzheimer's. We could help control diabetic sugar management, the people who are on insulin, the people who are doing all these other things. And what about some of the physical signs we can see of of structural issues like sleep apnea, and especially pediatric sleep apnea for children? I would love for Dr. Watkins to talk a little bit about how, what we do, because she helps us manage a program where we look at people and we manage their sleep quality as well. It's an incredible opportunity. So my mission is to create this in my practice, but not only in my practice, but to create this with other practices all over the world. This concept, Anne-Marie, is timeless, and there's no regional boundaries. We're human beings all over the world, and we all need this information.
And the other thing, as you're talking and as I'm listening to you, I'm thinking about, People don't realize that once they get these debilitating chronic diseases, like once you're diagnosed with diabetes or cardiac disease or what, you're in for the long run for probably the rest of your life. And then we're talking about the human cost, but how about talking about the financial cost? I know people that are paying $1,000 a month for insulin.
Hmm.
Now, what if we could turn back time? As Cher would sing, if we could turn back time and go back to a point where we were able to stop it, actually able to have this easy peasy diagnostic investigation that you do, because there's nothing invasive about it. You're doing a saliva swish. Is that what you call it?
Correct. Chelsea, want to talk a
Chelsea,
little
tell
bit
us.
about the saliva? Yep.
Yeah, so to collect the sample, if you would benefit from a salivary diagnostic test, it's just a 30-second swish and spit. We can use that sample for multiple tests in the office, so you don't have to do it more than once, which is an advantage. And the other test option we have doesn't involve us any swishing solution. It's just raw saliva. So we just ask you to spit a certain amount into a test tube, and that's all there is to it. We take some photos, fill out some paperwork, but it's relatively painless compared to some of the other procedures and medications and diagnostic costs that you could face in the future.
It's totally, just a walkthrough. You're just basically taking saliva out of your mouth, and then you're looking at it and seeing what you see, and then sharing it with the consumer or patient. And to me, I think everybody should get it. I know you don't do this as a rule. No dentists are hardly any dentists are doing it, but you are doing it, and people who practice the way you practice and the Wellness Dentistry Network are doing this, which we're very thankful that we have you and that we have dentists that are also responsible for preventing all of these horrible diseases. But it's a simple, and this is my question to both of you. Why don't you just do this as like you come for an exam? Why don't you do it on everybody, the swish and spit or the examination of the saliva?
Well, we've just started this year adopting that philosophy because we're surprised at how much we see in even just the general population. And this technology is not new, Anne-Marie. It's been around for 13 years. I started with it 13 years ago. And I'm somewhat of a pioneer and a leader in this arena. And I can tell you how significant it is. Dr. Watkins and I have a chapter in an integrative cardiovascular medicine textbook about this, teaching physicians about this whole concept. So the science is true. It's here to stay. This will become the standard of care one day. We're just very, very early in the genesis of this concept and this idea. But to your point, we do want all patients to know what the makeup of their oral microbiome is. It could have a huge impact on many areas of their health.
Yeah, because when you stack up at the one end these critical, catastrophic life sentences that once you're diagnosed with it, especially Alzheimer's. Unless you've known somebody who suffers from Alzheimer's, there's no turning back. It's just you get worse. There's no treatment. There's no cure. That's it. And if nobody wants to get it. Nobody wants to have to take care of someone who's got it. And the cost, the human cost and the financial cost and the burden of and the years that the patient has to suffer, even with, the debilitating cost of diabetes and having to take insulin injections, the financial cost. Now here we have a simple, stupid test that you can get. But the key is being able to go to a dental practice where they're doing this, because the physicians are not doing it.
Mm-hmm.
Your doctor's not doing it. So your only chance of getting this done is to hook up with or go to a practice like yours. It's pretty miraculous when you stop and think about it. And it's
a really amazing opportunity. And not only do you just want the information or the data from the test, but you got to know what to do with it. You got to know what to do with the information once you get it. So that's the other part. And that's what's taken me probably 10 years to figure out, is through trial and error and doing a lot of work on a lot of people, is trying to figure out what works predictably, routinely, so that we can help patients without them spending extra money or without them doing a lot of extra work that they don't need to do. And that's what we've done at the practice, and that's the program that Dr. Watkins and myself direct. And that's what we do on a day-to-day basis. So we would be happy to see anybody that wants that information.
And then another topic I want to talk about sleep apnea, because most people don't know that sleep, first of all, they don't know that it can be diagnosed. They don't know what it is. Few people know anything about it. But we all know now that it is one of the major contributors to heart attack and stroke and heart disease. And so, Dr. Thompson, you've talked about pediatric sleep apnea. What are you doing to detect sleep apnea patients in your practice?
Well, one of the biggest things we're doing is we're asking some simple screening questions. Look, I want to make it really easy for anyone who's listening out online or on the air. If you have a child or someone making sleeping sounds, i.e. snoring, 70% of those people have some kind of sleep disordered breathing. That means they don't breathe normally while they're sleeping. And snoring is the first sign of an airway constriction because you have vibrating tissue that's creating an issue for them. And people think it's cute to see their children snore or to watch their children. They think that they take videos and they put online, they think it's really cute. It's not cute. It's the first sign that that child has an airway problem. And if your child has an airway problem, there's so much other neurodegenerative issues that happen. Poor cognitive control, which means poor learning, behavior, bedwetting. I mean, all these things should not happen in the pediatric population. And so we have some screening forms, and we want everyone to know what happens. And maybe Chelsea, as we come back from the next break, maybe Chelsea could explain the home sleep exam that we have. That's super easy, less than a couple $100. It's so easy for people to do.
Very important. Let's talk about that on the other side of the break. In the meantime, you're listening to the Dr. Doug Thompson radio show. We're talking about oral health and disease prevention. If you have a question, you can reach the doctors directly by calling 800-859-0957. Again, that number is 800-859-0957. You won't want to miss this chance to talk to the doctors directly. You're listening to the Dr. Thompson radio show on 760 WJR. So here we are. We are back on Facebook Live, but I think we definitely need to cover the sleep apnea test.
Okay.
Because, people are I don't know. There's a lot of great hesitation because if you talk to people, what do you know about sleep apnea? Probably nothing. If you get sent for a sleep apnea test, you've got to put up with staying overnight, lying in a bed, being watched with people behind a screen, and then getting a mask. And that has really, developed into a much easier process over the years.
But also
So-
the pediatric side of it is interesting because a lot of people don't think of kids with sleep disorders, in my opinion. You normally think of adults, right?
Mm-hmm. I think
Correct.
we've talked about this on the show before too, but there's such a stigma behind the type of person who would have sleep apnea. So if you don't think you fit that mold, you automatically write it off and you say, oh, I just snore, but I don't have a problem, or I'm just tired, but I don't have a problem. And that's not the case. There's no poster of what sleep apnea looks like or what it is. It
Oh, that's a
affects
good
so many
point. There is
people.
no poster. No one knows about it. I don't mean to interrupt, but go ahead.
No, yeah. No, that's it.
It's that they don't know. They don't know what it is. And they, if you say, well, if you snore at night or, you have difficulty breathing, but they don't realize you can also die from, sleep apnea. There are people who just stop breathing and don't start up again.
Mhm.
And I mean, it certainly is, it's a scary concept that it's very misunderstood. And unfortunately, your average PCP, your primary care physician, is not going to necessarily put that on the grid for you to go out and get a sleep apnea test. And I think a lot of people who are, if it is suggested to them that they get a sleep apnea test, right away they think about, well, what is that? Oh, I've got to go and spend a night in a clinic. And that's kind of dodgy for people to get comfortable with that idea.
Sure.
And then just the having to deal with the mask and, dealing with that whole contraption. And now you've got this new process. We need to come back and talk about that. We need to talk about that, what that process involves, because it's easy. And again, I think this is another one of these tests that everybody should get. What do you
Mhm.
have to lose? You're taking we'll talk about it online, but you're actually taking something home and sleeping in your own bed. And then you're turning we'll talk about it, what exactly it involves. But, again, it's another diagnostic tool for cardiac disease.
Mhm.
and I don't know how many other diseases. But again, I think that should be a standard test. Everybody should get it. What do you have to lose?
Right.
And especially when you're talking about pediatric, I didn't know about it until you told me that existed. And I'm thinking, most people put their kids into a bedroom and shut the door. How do
Yeah.
you?
We have a very simple device. And Chelsea, we should probably let our listeners know that I don't want to do like a coupon online or something like that, but we'd be willing to do some tests for some people at a very inexpensive fee. I want people to know. They need to know.
Well, they need to know the importance of it, first of all. And again, I think that these tests should all pretty much be routine. I mean, I just think that, you go to your doctor and you get standardized tests. I mean, we got 30 seconds. I mean, you're sent for a mammogram every year. Why not? You know what I'm saying? It's like, why not have that be? There's more danger coming from, undetected sleep apnea, I would think.
Mm-hmm.
What are the percentages?
No question. No question. The medical comorbidities to not being able to breathe are huge,
Yeah.
especially at night. People wake up tired. They wake up confused, brain fog, growth issues, just a number of things.
Exactly.
So-
Well, we've got to continue on. Welcome back to the last segment of this special live edition of the Dr. Thompson radio show. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Thompson about his state-of-the-art clinic and his practice of prevention. This is our final segment, so if you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957. Okay, Dr. Thompson, tell us about the test. We really need to know about this sleep apnea test.
Yeah, it's a very simple wristwatch type thing that you wear in bed at night. And there's an app on your phone actually that you engage this testing device, and it gives us all kinds of information about your heart rate, your breathing rate, how your sleep position, snoring, how loud your snoring is. It's an amazing piece of technology that's gotten to be very affordable. I mean, this is typically under $300. If you have a WJR listener, we want to make it under $200. I'm willing to do that for them. I think that it'd be a nice opportunity for anybody to wear this device at home, and you wear it in your own bed. You don't have to go to a sleep lab. And
Right.
If you have sleep apnea, if you have any kind of breathing disorder at night when you're sleeping, you really need to think about getting some kind of treatment for that. And especially if you have any little kiddos that are having problems sleeping or have, dark circles under their eyes or have other bedwetting, other issues, behavior issues. These are ideal opportunities to find out if there's a sleeping problem, because I can just make it easy for you. If you can't sleep, if you can't breathe well at night, it's going to have a long-lasting effect on your overall health, for sure.
And I think the problem is most people don't know what the quality of their sleep is. You fall asleep and then you wake up, but you're not really sure. I mean, what kind of quality of sleep did I have? Who knows? I mean, you might have stopped breathing umpteen times during the night and not known about it. And, again, I think it's one of these tests that everybody should get. And like you said, anything under $300, or as your offer to the WJR listeners for $200, I mean, that's pretty amazing, because it's the security of knowing you're going to know what the results are. You're going to know about the findings. And when they take this home, they sleep in their own bed, they come back to you, what's the next step? They return the equipment, whatever they're sleeping with, they bring it back.
Yeah, no, it's actually today it's disposable. So they can bring it back to us for recycling, but I'll basically let Dr. Watkins address this next issue because she just made the most recent one. But, everybody thinks you have to wear some Darth Vader mask at night and you're going to look like some feature out of a movie. Well, that's not true. We can make oral devices today and oral appliances today that can help with this. So Chelsea, maybe you talk a little bit about that. I know you made the most recent one in our office.
Sure. So once you get the test kit, you can just pick whatever night's convenient to set it up. As Dr. Thompson mentioned earlier, you hook it up to an app on your phone, follow the instructions on the app and the instructions that we give you through the office as well. It's quite simple to set up. It's easy to put on. It's just really a heart rate monitor that goes over your finger, almost like a band, like a wristwatch that goes around your wrist that's comfortable as well. And then a heart rate monitor that sticks to your chest. And the instructions show you where to put it, what hand and finger they recommend. Once you wear it, you'll wear it for the whole night and wake up the following morning and just make sure that the information syncs with your phone before you throw the device away. But then you can either throw the device away or bring it in for recycling. And within 24 hours, you get a report that shows you. Also, as Dr. Thompson mentioned earlier, it shows you different statistics about how often you woke up throughout the night, how much time you spent in each different phase of sleep. It shows you how many times you stop breathing, if you do stop breathing, and then it gives you a score based on all of those metrics that almost kind of grades your severity of sleep apnea. And based on that score, there are different treatment modalities or different referrals that we may recommend if necessary as well.
So let's talk about some of the simpler treatment modalities. You were talking, Dr. Thompson, about you can get something, some contraption made that you would insert into your mouth every night. Is that how it would work?
Yeah, Chelsea, you just made one. Can you explain what those
So
appliances are?
there are different appliances that basically just reposition your jaw forward. So it allows your airway to open so that you get more air throughout the night. They're very similar to a night guard that maybe people have worn in the past if they were ever told that they grind or clench their teeth. Or if you wore one for sports, it's similar, but it's a little less bulky than the one that you would traditionally wear for any kind of athletic event. But they're quite comfortable. They're not too bulky or thick. Some of them are flexible too. So just depending on what you think you might find the most comfortable, there are different options for you. But it might range from some kind of appliance to something as simple as just lip sealing at night and putting a piece of tape over your lips to encourage you to breathe through your nose so that you're getting better air quality and better sleep quality as well.
And then after they get this appliance and take it home, and when do they come back for a checkup to find out how they're getting along with it? What's the follow-up?
It depends on what type of device you recommend or what type of device the patient ends up choosing. With one of our devices, the most common one we recommend right now is called an EMA appliance. And with that, you get different length and strength of bands that reposition the jaw. So usually we'll send patients home with several lengths and strengths and explain how and when to change them. And if the patient's feeling like they're improving, but they want to try a different band, we'll usually bring the patient in about 2 weeks to get some feedback on how they like the appliance, if it's working for them, if they're wearing it. And then once the patient and we feel like the band size and strength is great for them, we'll often rerun the sleep test to make sure that the metrics are changing with how the patient feels.
It's amazing that we have this technology and that things have been simplified to this point now where you can actually do the test at home and then get a device made that's going to be custom made for you and that you can improve from sleep apnea, which we all know is a very dangerous thing to have and always misdiagnosed a lot, or missed, I should say. So I'm going to ask both of you doctors, we have less than a minute left. Integrative oral medicine, have we described what it is?
Yeah, I think I can tell you, Anne-Marie, that practitioners that have a keen awareness about how oral conditions affect systemic health can say and do things for patients that can totally change the trajectory of their lives. When I first thought about the concept, I thought it was the future. It's not the future. We're doing it right now. So we would love to have people come and see us and we could help them with those things. And Chelsea, you might want to add some additional comments.
Yep, we got 25 seconds. Tell us.
I think it's just a better way to serve your community and your patients, and a way to promote wellness and health in a different, unique way, and in a unique setting that really shouldn't be so unique.
No, and absolutely. You've got to see your dentist anyway. We have to go and see a dentist at least once or twice a year. So why not take advantage of going to a clinic like yours? Well, unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on News Talk 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Thompson and Dr. Watkins for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. Thank you also to my co-host, Siobhan Cronin. To learn more about Dr. Thompson's practice, you can reach him directly at 248-642-1000. Again, that number is 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope that you've enjoyed this special show and that you've become more informed about oral health and its impact on the major diseases of our time. Good night, and thank you for listening. Good.